This video summarises one of the PEDro top 20 trials. The trial was led by Anna Beurskens. It is a randomised controlled trial that investigated the efficacy of traction for non-acute, non-specific low back pain. The trial was conducted in the early 1990s when there was limited evidence to guide the treatment of low back pain. Preliminary evidence suggested that traction may be beneficial, but the trials were small and had poor methodological quality. The aim of this trial was to estimate the average effect of traction compared with sham traction on perception of recovery in adults with non-acute, non-specific low back pain. 151 participants were recruited from primary care in the Netherlands. The main eligibility criteria were being 18 years or older, having non-specific low back pain with or without radiation for at least 6 weeks, and never receiving any form of lumbar traction treatment. 77 participants were randomly allocated to the traction group and 74 to the sham traction group. Allocation was concealed. Both groups received 12 20-minute treatment sessions over 5 weeks using a similar traction apparatus. Participants in the traction group received the traction force that was between 35% and 50% of their body weight. Participants in the sham traction group received the traction force that was less than 20% of their body weight. The primary outcome was the participants' global impression of their recovery after 5 weeks of treatment. This was rated on a 7-point scale that was dichotomized into improved and not improved. Participants were blinded to group allocation. Because the outcome was self-reported, the assessors can be considered to be blinded. Analysis was by intention to treat. 44% of the participants in the traction group improved, compared to 51% of the participants in the sham traction group. The absolute difference between the groups was 7% in favour of the sham traction group. The 95% confidence interval ranged from 23% in favour of the sham traction group to 9% in favour of the traction group. Because the 95% confidence interval included 0, there was no difference between the groups. The authors concluded that traction should not be used in clinical practice nor prioritised for future research.